Abortion. It is one of the most common, yet most debated medical procedures worldwide. Every year, an estimated 73 million induced abortions take place. 6 out of 10 unintended pregnancies and 3 out of 10 of all pregnancies end in abortion. When correctly done, though, following World Health Organization guidelines, abortion is a very safe health intervention, but nearly 45% of abortions globally are unsafe, making unsafe abortion a major preventable cause of maternal deaths, lifelong complications, and economic hardship for women, families, and health systems. So today on Spring Clinic, in proud partnership with the Office of the Chief Medical Director, Union Teaching Hospital, Oshobo, we explore the medical, the legal, and social realities of abortion in Nigeria and beyond. My guest is Dr. Segun Ilori, specialist obstetrician and gynecologist at UTH. He brings expert insight into safe practice, policy, and patient care. Thanks for joining us today, Dr. Ilori.
Thank you.
Thank you so much.
Yeah.
Today, we hope that you give us, lots of insight from the, the safe practice of abortion, how, it is accepted in this part of the country, how you practice it, if it is accepted or not, and all of those issues, and even the legal aspect. But let's begin at the heart of it. Global and local context. I mean, globally now, abortion is common, but in Nigeria here, access is heavily restricted.
Yes.
Talking about, how people can actually access it. And could you help us understand the difference between the global picture and our local realities, both in terms of numbers and safety?
Thank you very much. I want to appreciate you for having me. This is one of the intention of the authorities of the Union Teaching Hospital that has the our able and dynamic CMD, Dr. Afolabi, as the CMD. So it is one of his intentions. It is one of his desire to make sure that the populace of Osun State is well educated as far as the issues of their health is concerned. You see, abortion is, just like you said, is heavily restricted in Nigeria. And if it is heavily restricted in Nigeria, that means even in Osun State, you have it heavily restricted as well. Some of us that work in government institutions, as in hospitals, almost on daily basis, we see people presenting in very bad conditions following complications of abortion. And that is why a program like this is really needed and should be welcome. Worldwide, just like you said, about 73 million pregnancies that end in abortion take place. That is a huge number. And if you come down to Osun State, about 60% of pregnancies that occur in Osun State that are recorded, those are the recorded pregnancies, end up in abortion.
60%.
60%. That is over 1 million of people that come down with unsafe abortion in Osun State. And you see, unsafe abortion has taken a lot of lives. So if we have this kind of a number, then all hands must be on deck to reduce the number. So that is what I just have to say about
that. All right. Let's begin at the basics. It's unsafe to just assume that everybody knows what abortion is.
Okay.
Let's begin with what is abortion? And then we now go to what is safe abortion and what's unsafe abortion.
Okay. Abortion, simply put, means the expulsion or the extraction of product of conception. When I say product of conception, I mean the growing fetus, the placenta, maybe some membranes of the sac that contains the fluid in which the baby is growing. So when there is that expulsion or extraction in part or in whole before the age of viability, that is abortion. I need to let you know that that age of viability differs for different regions. Like in Nigeria, the age of viability here is 28 weeks. The meaning of that is that by the time there is either extraction or the expulsion of product of conception before 28 weeks of gestation, that is an abortion in Nigeria. But it may not be so in other climes where they have improved facilities. Like in the United States of America, abortion occurs before the age of 20 weeks gestation. In the United Kingdom, it is 24 weeks. World Health Organization stays in the middle, 22 weeks gestation, while South Africa is around 26 weeks. So any termination of pregnancies, whether spontaneously or induced, that is occurring before the age of viability is an abortion.
So whether it's natural, because
or induced.
In the medical line, you call miscarriage, right? Abortion
yes,
too.
I'm going to come there.
Okay.
There are different types of abortion in the sense of abortion. It could be spontaneous and it could be induced. Now, if it is spontaneous, there are different types of that too. Spontaneous means it is natural.
Okay.
It is not induced. You know, the person that is pregnant is not the one that is making attempt to end the pregnancy. Probably one thing or the other is what is now leading to, you know, the termination of the pregnancy. That is spontaneous abortion. And there are different types of them. We can have a spontaneous abortion that will be complete. That means the entire product of conception inside of the uterus is already out. That's a complete abortion.
Okay.
It could be incomplete abortion. That means that, you know, you still have some product of conceptions still retained inside of the uterus. That is an incomplete abortion. You can have a threatened abortion under that spontaneous abortion, such that the process of abortion is just beginning to start, but there is a chance for you to stop it, such that the pregnancy will continue to viable age. That is a threatened abortion. That's why when some people come and after review, we tell them this is a threatened abortion. You have to be on bed so that we can manage you, and then we'll stop the progression of the process that could terminate the pregnancy. Then we can also, from that, the spontaneous abortion, we can have, under that, we can have another variety that we call missed abortion. Missed abortion, simply put, means that the developing fetus had died, but the uterus is not making attempts to push it out. So the woman will still think that she's pregnant. The only thing that she will notice is that the symptoms of pregnancies, those things that she started feeling when she first got pregnant, will start reducing. And then she will be like, okay, if she was vomiting before, she will be like, okay, this vomiting seems to be resolving, and things like that. Not until, so most times, this diagnosis of missed abortion is often picked incidentally. That is, if the woman is not sensitive enough to the fact that, oh, could it be that this baby has died, that I'm now having resolution of some of the signs and symptoms of pregnancy? Do you understand that? So then it can also be an induced abortion. Under this induced abortion, it shows that it is the person that is pregnant that is now making attempts to terminate the pregnancy, either for one reason or the other. Probably the person is not ready for the pregnancy and the likes.
All right. I don't know which I should go for first. Okay. Is abortion legal in Nigeria?
Well, just like you said, abortion is highly restricted in Nigeria. In fact, the only reason for abortion in Nigeria is when it threatens the life of the mother. And to make assessment of that, it will not end with just one doctor. You will need at least one, two or more people affirming that this case of abortion that we want to do is indicated by the fact that the life of the mother is in danger. Hence, it will be a kind of a therapeutic abortion, so as to save the life of the mother. But it is not one person that will make that assessment, so that it won't be that the person is biased. So you need at least 2 or more specialists to review such a patient and come to terms with the fact that this is a case of an abortion that we need a therapeutic termination.
All right. We'll come back.
And also, in addition to that, it has to be in a government-approved hospital.
Okay.
You cannot say you want to offer somebody a therapeutic abortion in a facility that is not government approved. It's going to cause a lot of problem for that kind of a facility.
So government approved, now just to be clear, government approved is not government-owned hospitals. It is even, government-owned hospitals and private-owned hospitals that are approved.
Certified. Specialist hospitals. We have a lot of them in Osun State. But I know that most people, you see, knowledge will make you to be careful with whatever you want to do. When you see people that are very radical and careless, it could be a pointer to the fact that they are not knowledgeable enough. People that are knowledgeable enough will be careful with their practice. So that's why you have it that most of the people that are often being referred to, like Uni Osun Teaching Hospital, come from places that are not approved, that do not have people with the requisite knowledge and skills, and they are ventured into abortion. And so they will cause a lot of damage to the life of the patient. So that's what we normally have. All
right. Doctor, let's talk about the personnel that are involved in abortion. Who are these medical personnel that can actually carry out abortion? What part of the medical line is it? The doctors, the nurses, or there are specialists who carry out abortion?
Well, you see, what WHO, World Health Organization, recommends is that for an abortion to be saved, to be a safe abortion, it has to be carried out in a facility with minimum required standard. And also by personnel that have the required training.
Okay.
Anything outside that makes it unsafe. So that means a safe abortion is an abortion that is occurring in a facility with the minimum required standard and or by a specialist that has the requisite skill to do it. So whether doctors, whether nurses, whether midwives, if they have the required training, they can go ahead and do abortion, provided that it is supported by the law of the land. Or if it is a therapeutic abortion.
Yes. I was going to say that, ultrasound, it's a routine when you're pregnant. Is it also a routine requirement when one is to, undergo the process of abortion?
Ultrasound has a lot of role to play. Although you see, oftentimes the diagnosis of abortion, except in some few cases, is purely clinical.
Okay.
When you listen to the story of the patients, the presenting complaint, and you have examined, you have done the necessary investigations as minimal as serum pregnancy test or the one you do urine pregnancy test, you will have this high index of suspicion that this could be an abortion. However, to hit the nail on the head, if you do ultrasound, what ultrasound does is that it's going to show you the inside of the uterus and whatever is growing there. It will allow you to know by certain measurements whether that pregnancy is growing as expected or not. Like in the case of missed abortion, ultrasound has a lot of roles to play, or a very key role to play, because the patient would have died. The patient, the fetus would have died and is no longer growing as expected. The woman may not know because she may not spot, she may not have lower abdominal pain. In fact, most of them will just come for the routine antenatal, and you see, as part of the investigations you want them to do, you ask them to do ultrasound, they go for the ultrasound, and at the place of the ultrasound, they will tell them, sorry, for how many weeks did you say that you have missed your period? Some of them will say 10 weeks, and what the ultrasound will be reading would be like maybe 4 or 5 weeks. They will be like, the correlation is not there. Shows that the pregnancy is not growing. And it is ultrasound that is helping us to pick that. So ultrasound will show to us whether the fetus is growing as expected or not, whether the fetus has stopped growing. And in cases of incomplete abortion, when some of the patients will come with profuse bleeding, I still saw one during the night today before coming. Yes, in fact, we had to transfuse 2 units of blood. Imagine if there is no facility like Union Teaching Hospital around, or some of the specialist hospitals that are around, such a lady that has lost that large volume of blood, what will happen? But ultrasound will let you know, if you do ultrasound, really know that, oh, this lady that is bleeding, there's nothing in the uterus again, it's complete. Oh, this lady that is bleeding, we still have some product of conception in the uterus. Go and do something about it. So that's the role of ultrasound.
All right. We'll be taking the quick break now. When we come back, we'll delve more into the safe and unsafe abortion. You know, how when you talked about, you know, some components of the fetus still remaining in the mother. Dear viewer, we'll be taking the quick break. When we return, it's Small Conversation. Stay with us.
Up to 75% of all new human diseases come from animals. Ebola, anthrax, and monkeypox all came from animals. And as more dead wild animals are being transported to our cities, we risk introducing an
ultrasound. People who engage in it. Okay, let's talk about how would I put it now? Self-managed abortion, you know, like a person who just gets a pill over the counter and all of such practices. In such cases, in some places, the WHO allows, you know, all of that. But in Nigeria, where we have, you know, people who can just go over the counter and get things and do all of those practices themselves and are unsafe, how do we manage that in a place like Nigeria? You know, with limited resources. I'm talking about facilities that are not, you know, state of the art.
You see, why a lot of people would prefer to be secretive about the management of their unplanned or unintended pregnancy is because of the stigmatization, the fear of the hospital costs. And also the fear of what people will say, oh, I'm pregnant. A woman has the right to get pregnant for whatever reason. And also she has the right to say, okay, I don't want this pregnancy. Unfortunately, in our environment here, the laws will not permit anybody to just go do indiscriminate termination of pregnancy. And because of that, you have some over-the-counter medications that can be used to terminate pregnancy. About a month ago now, a young lady who happens to be maybe a worker in one of the hospitals around got pregnant, and together with her and her friends, they decided to terminate the pregnancy. And they used some of the over-the-counter medications. Unfortunately for her, it became complicated. They were still keeping her, keeping the thing to themselves until she fainted at home. By the time she got to the hospital, she was unconscious. She spent over 3 weeks in that unconscious condition. You will not want me to bore you with the other aspect of her management. These are some of the things that are being encountered from people that would rather prefer to do self-medication and self-care of their abortion. Well, up until now, up until the time that this program started, I'm not aware of whether the federal government of Nigeria had lifted the restrictive laws on abortion. And so it remains the way it is, except for therapeutic purposes. Although there are certain states of the country that are already coming up with some exceptions. But recently, one federal high court in Abuja gave a kind of a minimal access for people that got pregnant from cases of rape, incest, and things like that. Also, I think in Oyo and Ogun states, they are beginning to come up with that kind of laws, you understand, or bills, yes. So it is not advisable. It is, even if such care will be done by the patient, assuming is a place where abortion is not restricted, you need to carry along your doctor, so that the doctor will be giving you, certain instructions that will really help, because it's a thin line between life and death. So that is what I have to say about that. Yes, of course, we have a lot of medications now. I'm telling you, just get to the pharmacy. Nigeria pharmaceutical, whatever, is so, so to say, porous. Anybody can get to any pharmacy and you tell them, please give me so tablets. Without much of ado, you get whatever you want to get. And then some of them go home, they insert the stuff. They don't know what is next to do. When should this be that, and things like that. And that's caused a lot of problems.
Just to buttress that point more, I want to ask, just like malaria and all other ailments, if you go over the counter and you get drugs, you use it, it works fine. Basically, there aren't complications. What causes complications in pregnancies? I mean, getting an over-the-counter medication, probably pills or whatever it is that, they get. What causes, complications at the end of it?
Like I told you that...
why should there be complications?
Yes, that there are different types of abortion. Under the spontaneous abortion, we talk about the complete, incomplete. Because of the lack of the adequate dosaging, knowledge about the adequate dosaging and the interval of the dosaging too of the medication. Some people will just use. Some will overdose themselves, some will underdose. And in such cases, we definitely have complications because the uterus is an hollow organ. So when there is anything inside and you stimulate the contraction, the uterus will continue to contract, wanting to push out whatever it is inside. But if the adequate dosaging is not done, there are times that if you want to procure abortion, drugs will not do certain types of abortion, depending on the gestational age. If you are using drug to terminate certain types of abortion, the best you can have is to have a part of the product of conception will come out, but a part will still remain. And that is why it is not just, oh, this is an abortifacient, it's a drug that can cause abortion, let me go and get it. No, you need the knowledge. And it is because the law is still prohibitive, sort of. That's why people are just going behind to, taking the back door to, and that's why we're having the complications that are attending to them. So what am I saying in essence? We need public awareness for people to know that it is not all pregnancies that you want to terminate, that we just require you to go to the pharmacy to go and get medication, and then as soon as you use it, you expect the whole thing to come out. It doesn't work like that. There are times that what you will have eventually will be incomplete abortion.
Incomplete abortion. How unsafe is it? I mean, what are the consequences of that? Short-term, long-term?
If it is not managed promptly. You see, maternal mortality is one of the monsters, so to say, that, you talk about death of a woman. Oftentimes, a pregnant woman, a woman that is pregnant or that the pregnancy has been terminated, dying as a result of that pregnancy, you understand, or the management of that pregnancy. One of the causes of the maternal mortality is this unsafe abortion, which oftentimes leads to incomplete abortion. So it takes life if care is not it. So you don't want to have incomplete. I told you that over the night today that I had something like that. She got 2 units of blood. When she was inserting what she inserted, when she was inserting it, she would never have imagined that this thing I'm inserting by myself will land me in the hospital in between life and death condition, and also earn me the need to take blood. If she has had, assuming the abortion law is not restrictive, she has worked in, they would have just done maybe manual vacuum aspiration for her, she'll be fine and go home almost immediately. So incomplete abortion is not what you want to have on your hand. Let me tell you that spontaneous abortion, it is not only induced abortion that can lead to incomplete abortion. Some women that really desire the pregnancy get pregnant, we have this spontaneous abortion. Some of the products of the conception will come out, while some will still remain. You know, that one is not, it is not a criminal thing. It's a spontaneous thing. Right. But as much as it is a spontaneous thing, we still threaten the life of the person that is having that incomplete abortion, despite the fact that it's a spontaneous abortion.
Okay, so are you saying emphatically, doctor, that even if you have spontaneous abortion, let's call it miscarriage for better understanding, you still need to get to the hospital so that, proper medical interventions can be taken,
Yes. Let me use this to educate our listeners. Anybody that is pregnant, you see, blood is life. The life of every man, every woman is in the blood. So any event that will lead to loss of blood should not be trivialized. It should make you see it as a race against time. You get to the hospital as fast as possible. A pregnant woman that is either you are beginning to spot blood or you are beginning to bleed and you are pregnant, don't stay at home. Quickly get to the hospital and ask questions. Relate with your doctor. Let them review you and make their assessment and manage you appropriately afterwards. You get? So that is what I have to say on that. You don't want to have incomplete abortion on your hands.
All right. Let's talk about this now. As a medical practitioner, would you push for the Nigerian constitution, so to speak, or the medical laws to make it a bit, if not totally, at least, more like establishing some special hospitals for abortion. Would you push for such, or would you push for a total policy shift?
Yes. You see, like I was telling you that in Ogun State, also in Lagos, I've read that account where they were trying to lift some ban to have a state kind of a bill that will permit people to procure abortion. And as soon as that information got to the hearing of some people in the states, they rose against it vehemently, such that the government of the day had to withdraw. For, those people that rose against it for religious reasons. That no, it is not religiously right. I'm a religious person too. We all have our religion. But you see, we must be able to balance things. If at all abortion law will be a bit, will become a bit more relaxed, such that it can accommodate for certain special cases, I think it will be fine. Certain special cases in the sense that, you see, intimate partner violence. I am against induced abortion.
Okay. Personally.
And I don't do it for my own reasons. But I've watched people die from complications of induced abortion. So how do we strike a balance? Some people got pregnant from relationships that are very toxic to them. Intimate partner violence. Husband coerced them, assaulted them, got them pregnant. Such a woman will not want to carry such a pregnancy. That is one. Two, a house burgled by armed robbers. In the process of robbing the house, got their daughter pregnant, raped the daughter, got the daughter pregnant. Now, a 16-year-old girl is pregnant. For a father that will never be known. She's a young girl, has career in front of her, has all manners of things. As a mother or as a father, because most of the times, the talking is easy when it is not affecting you directly. In this year of my little year of practice, I've seen pastors' wives of Muslim clerics wanting to do about it. So what are we talking about? In some of these special cases, like incest, rape, the pregnancy threatens the emotional stability, the general well-being or health of these patients.
Yeah.
There should be allowance for termination of such a pregnancy.
All right.
Unlike somebody who just,
just wishes it,
being careless and just want to go somewhere to go and.
But how about other interventions like putting up the babies for adoption?
Yes, it's part of those are safer options. Those are options that a lot of people will put forward. That you can go for adoption services. We have them in Osun State. We have them all over. Osun State Women, Children and Social Affairs Commission would take babies that are brought to them. So that is another option, which is very safe. Counseling too. That why don't you just carry, don't go for abortion, and after you can also take care of the baby will be fine. Counseling and emotional support from people around. Why a lot of people will go for abortion is because of the stigmatization or the emotional hurt in a relationship. And some people too, we need to say it, got pregnant from unfaithfulness to their partners. And they will not want the partners to get to know that. Imagine that kind of a person seeking for abortion. In fact, those kind of people should be dealt with. I'm sorry to say. I don't want to sound...
All right, so doctor, let's talk about this. The over-the-counter pills, the pills that you call emergency contraceptive pills, right? Or the morning after pills. Are they the same as abortion pills?
No.
They're not?
No. Abortion pills are those pills that we call abortifacients. The purpose of abortion pills, those abortifacients, is to cause abortion. Post pills, emergency contraceptive pills, their goal is to help prevent pregnancy. And you see, the advent of this abortion pill has saved a lot of people from unwanted pregnancies. Imagine a case of rape, and I will use this to educate the populace again, that any case of rape, any case of incest, please don't stay at home. You can still remedize. You can still prevent unwanted pregnancy from that rape if the person presents early enough.
Like how early?
Sometimes
Fair range.
72 hours after the assault. There are some medications that we can give that will take care of the pregnancy. It will not allow the pregnancy to occur. There are certain interventions that we can do that can be up to like 5 days intervals. You know, the pregnancy will not occur. Rather than keeping it to yourself. Oh, I've just been raped. Oh, there is a case of incest, and you keep it to yourself until you get pregnant. And a lot of people in town, it's like the awareness is coming up well now that a lot of people are getting aware that there is something called post-pill. In fact, I don't want to be mentioning for the purpose of not wanting to advertise for certain drug companies.
Okay.
If you get out now, you mention certain names of some drugs, some people will look at you, we know what it's used for now. It's a post-pill. You understand? So people know about it.
Overall.
Just that people use it. Some people, I have a very close younger person to me that called me about 4 or 5 years ago when she was doing her youth service call. And she was like, Egbon, there's this drug that I've been using every day. I said, wow, you are using, it's supposed to be a post pill, morning after pill. To prevent, it's not the routine family planning pill. When you have cases of emergency, unplanned sexual intercourse, so to say, that is when you use those pills. Or maybe a family or some people are meeting together, there is a burst of condom, there is an incest, there is rape, you understand? Or you are not sure, somebody that is using the routine family planning pills and you forget to take your pill, and then you now have something after that. Those are the reason for the indication for the use of those post pills. Not that you'll be using it every day. It's not for everyday use.
In a few seconds, doctor, how central is safe sex practices and education? You know, how central should it be these days? How well should people, you know, talk about these things because of the kind of community we found ourselves, where we have this prohibitive law about abortion. So how alarming should you ring that bell?
We should ring it loud and clear. Because it's better to prevent the pregnancy than to get pregnant and start seeking unhealthy means of aborting it, which can land the person in trouble. The ABCD of what do I call it now? The awareness for safe sex practice still remains. That you should abstain If you're not ready, emotionally, age-wise, blah, 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 you are not ready, abstain. If you are married, you are in a relationship, be faithful. Then, use of condom. You understand? Then, family planning methods should be encouraged. We should give education everywhere. A lot of parents will not want to educate their children about sex and how to go about some certain intimate things. But the funniest thing is that, except if your children don't have access to their friends in school or they don't have access to phones, that's when they will not have this information you are trying to hide.
Yeah, we don't educate them inside.
So you have to educate them. You have to let them have this tete-a-tete, yes, intimate conversation with you as a parent. That will go a long way to help them. So my candid advice is that one of the ways to prevent unsafe abortion is, if you are not ready for pregnancy, abstain. Then, use of family planning methods. If you know you cannot abstain.
Dr. Ilori, thank you for helping us unpack, such a sensitive discussion, having that kind of discussion and on a very, very vital subject. Abortion is not just a medical issue. It is a public health and human rights issue. Safe procedures save lives. Unsafe ones take them. You've heard it from our guest today. Now to you viewers, knowledge is power. And the more informed we are about our bodies, our laws, and our health options, the better we can protect ourselves and support one another. Now let's build a society where no woman's life is put at risk because of silence, because of stigma or lack of access to care. Once again, we thank the office of the CMD, Union Teaching Hospital, Oshobo, for partnering with Spring Clinic to bring this conversation to you. Until next time, I'm Timitope Ajijola Oluola. Stay informed, stay healthy, and stay empowered.